Ready when you are.
Okay. My name is Dr. Nicole Kibler. I'm a chiropractor here at Arizona Pain Specialist, and throughout these video segments, I'd like to discuss some different chiropractic techniques that we use here that are well researched and proven effective. Because we see such a large number of patients here that do have low back pain, I'd like to start with one of the newer techniques called Flexion Distraction. This technique is used on a lot of patients that have low back or leg pain. We can also use it on those patients that have been diagnosed with disc herniations or bulging discs, facet syndromes, even sciatica or pinched nerves, spinal stenosis, and arthritis as well. This is also a great technique to use on women that may be pregnant and experiencing low back pain as well, or for those with osteoporosis and patients that may wish to avoid those chiropractic procedures involving a clicking or popping. So I'd like to first demonstrate on a model what's happening mechanically with this treatment. With the use of a specialized table, we're going to introduce a lengthwise stretch for the spine, moving that disc away from the nerve. The foraminal openings here, which is where that nerves come through, that area enlarges, which allows more space for that nerve to come through. Additionally, the facet joints in the back of the spine, they separate, which helps take pressure directly off the nerves, pressure off the joints, and actually restores normal range of motion within the joint. So I know this can look a little bit intimidating, but our patient is very comfortable lying on the table. We can change the table setup based on those patients that may have a larger abdomen or for those patients that may be pregnant. So I'm going to be focusing on the region of the spine of the disc or nerve involvement. So I'll first add some tension to the spine, and then we'll stretch downward in order to lengthen the spine, moving that disc away from the nerve, just as we showed earlier on the model. Okay, so I'll add my tension. We'll stretch the spine forward and then up. Good. So this is a very comfortable and effective treatment that helps restore proper motion to the spine and also helps assist the soft tissues like the muscles and ligaments surrounding the spine to heal. There's also a side-to-side or lateral bend mechanism built into the table, which helps stretch the core muscles attaching to the spine, as well as alleviating pressure on the lower back. So I'm going to add some tension, and we'll do the side-to-side stretch. As you can see, this is a very safe, gentle, and controlled technique that helps the spine to heal. I'd like to encourage you to tune back into some future video segments that we'll have here to learn more about additional chiropractic techniques that we use at Arizona Pain Specialist in order to help alleviate your pain and achieve your optimal state of wellness. Additionally, how these techniques fit in to complement the multidisciplinary approach to treating pain.